Good morning, everyone. I'm Chuar from Monash University, Malaysia. Today, I'm going to present my work with the title Bioenhanced Tocotrienol-Rich Vitamin E, Tocovid, improves nerve conduction velocity in type 2 diabetes mellitus patients in a phase 2 double-blind randomized control clinical trial. I'll begin by talking about the research background. Diabetic peripheral neuropathy is the most common type of nerve damage caused by diabetes, and it affects roughly 50% of the diabetic population. The symptoms one experiences depends on the nerve that are affected. One might experience loss of feeling, freezing pain, and tingling pain, just to name a few. Usually, these symptoms appear in the area covered by gloves and stockings. Thus, diabetic neuropathy is known to be having a gloves and stocking distribution. However, almost half of the patients are asymptomatic. Currently, the mainstay management of diabetic neuropathy focuses on symptomatic relief and optimal glycemic control without addressing the underlying pathogenetic mechanisms. Vitamin E is a fat-soluble vitamin which is widely known for its antioxidant, anti-inflammatory, and neuroprotective properties. There are two types of vitamin E, which are tocopherols and tocotrienols. Research has revealed that tocotrienols is superior to tocopherols due to the 3 unsaturated bond at the side chain. Palm oil is an important source of natural vitamin E, and it contains of 30% of tocopherols and 70% of tocotrienols. Now I'll talk about the pathogenesis of diabetic neuropathy. Persistent high blood glucose will lead to decrease in nerve growth factor and increase in ages formation, oxidative stress, inflammatory activities, and platelet aggregation. All these will eventually lead to diabetic nerve damage, which is reflected by decrease in nerve conduction velocity and decrease in the amplitude of action potential. We are hoping that by providing the patient with tocotrienol-rich vitamin E, it will help to reverse the nerve damage by increasing the nerve conduction velocity and the amplitude of action potential. Hence, our research group conducted a double-blinded randomized control trial with 88 eligible subjects for 12 months. 43 of them were randomized to receive 200 mg of Tocovid twice a day, and 45 of them were to receive placebo twice daily. The nerve conduction study was conducted at randomization, 2 months, 6 months, and 12 months after randomization. The nerve conduction study was repeated at 6 months after washout. 3 nerves were done in the nerve conduction study, which are the median sensory nerve, surosensory nerve, and tibial motor nerve. The primary outcome of the study is the mean or median change in nerve conduction parameters between the Tocovid and placebo groups. The secondary outcome is the level of serum biomarkers in order to explore the metabolic pathways of diabetic neuropathy. We are looking into 5 biomarkers, which is nerve growth factor, MDA, TNFR1, VCAM1, and thromboxane B2. The mean or median change in nerve conduction parameters from baseline were compared between the Tocovid and placebo group. In the median sensory nerve, the Tocovid group, which were represented by the blue color graph, show highly significant improvement in conduction velocity as compared to placebo at 2 months, 6 months, and 12 months of Tocovid supplementation. Similarly, for peak velocity, the Tocovid group show significant improvement up to 6 months. For surosensory nerve, for both conduction velocity and peak velocity, the Tocovid group showed highly significant improvement in both the parameters as compared to the placebo group. In tibial motor nerve, the Tocovid group also showed highly significant improvement in the conduction velocity as compared to the placebo group up to 6 months. However, after 6 months of washout, there are no significant difference between the Tocovid group and placebo group in terms of nerve conduction velocity for median sensory nerve, surosensory nerve, and tibial motor nerve. The level of serum biomarkers were compared between Tocovid and placebo group at 8 weeks. Out of the 5 serum biomarkers that were measured, only NGF were significantly higher in the Tocovid group as compared to placebo at 8 weeks. In a cross-sectional study, it was shown that an increase in 1 nanogram per ml of serum NGF, the odds of getting diabetic neuropathy decreased by 13.9. This suggests that NGF might be a potential biomarker for diabetic neuropathy. In conclusion, Tocotrienol-Rich vitamin E improves the conduction velocities for median, suro, and tibial nerve, and there was also significant effects on the level of nerve growth factor. However, the exact mechanisms of action still remains unknown. And also we have found that NGF is a potential serum biomarker for diabetic neuropathy. And these are the references. And thank you very much for your time and attention.